welcome to another episode of PodcastDX, the show that brings you interviews with people just like you whose lives were forever changed by a medical diagnosis. I'm Lita.
I'm Ron.
And I'm Jean Marie.
Collectively, we're the hosts of PodcastDX. On today's show, we're continuing our talk about routine health checkups. This episode is part 2 of a 2-part series.
Let me start by reiterating something we often say on the show. Everyone is unique and has their own health needs. You, your healthcare providers, and even sometimes your insurance company ultimately decide which exams and which tests you should have and how often you should have them. Some researchers, however, argue that routine medical exams for healthy adults are costly and unnecessary. And we have a link that we are going to be putting up from Harvard, and click on that and you'll be able to read more about it. And there are other people that actually believe that routine checkups are vital for your health.
Well, yeah, I can see both sides of that argument.
Mm-hmm.
On the one hand, why go to the doctor when you feel fine? On the other hand, routine healthcare visits may catch serious conditions in the earliest stages and allow your healthcare provider a chance to get to know you and your personal and family history and provide preventative care.
Sure. And here are some things you can do to make the most out of your doctor's visit. Be honest with yourself and your healthcare provider. They shouldn't be there to, and they're not intending to be there to judge you about your habits. But keeping them appraised of habits that can negatively affect your health can help them to help you, and it can help them guide you to resources or specialists that can help you help yourself. So, for example, smoking. Right. If you go to the doctor and say, oh, no, I don't smoke, but you are a smoker, and also they might want to request different tests.
Right.
Oh, and I just stepped on Ron.
Okay.
Ouch.
Sorry,
No
Ron. Okay.
It's all good.
Okay.
Well, before you visit with your healthcare provider, and we're going to abbreviate healthcare provider into the initials HCP. I don't know if H is easier to say.
Okay.
You should write down any questions you may have about your health and the medications that you're taking, if any, and make a list of any symptoms that you may have. I recently started using a medical and wellness journal to track a plethora of information that I can show to my healthcare provider or HCP.
That's great. So they can look for trends. And if you generally need like blood tests as part of your routine exam, ask your healthcare provider if you can get your blood work drawn a week or so before your appointment with them. Then you can actually go over the recent blood tests, the results, and ask questions you have about those results. And I like to have, the actual info printed out in front of me, along with maybe the past 2 or 3 blood tests, so that my healthcare provider can also look for trends. Like, is my cholesterol getting too high? Is it about the same for the past 2 to 3 years? Do they see something, that I need to make changes to? Like, can I change my diet or exercise routine? Right. Is my thyroid medication correct, and is it the correct dosage for me? Also, that can change, based on your weight. It's easier for me personally to look at a printout of the blood test results as we talk about it and maybe take notes on that paper. And I think that also can show me, the diet and exercise is working to lower my cholesterol. But if I wait and I have my blood drawn, right after my appointment, then they usually call me with the results. And for me, that's very hard to follow what she's saying. So now when I schedule my annual exam, I also ask to have my typical tests done in advance, like blood draws, MRIs, ultrasounds, mammograms, and everything a week or so before my appointment, so they have that info on hand.
That's a good idea.
Yeah. Actually, I'm going to go off script a little bit. If it's okay,
Yeah.
If you guys want to
Always.
edit it.
Yep.
Okay. What I see, one of the things, I think there's a difference, just my opinion, when you have a PPO insurance versus an HMO.
Right.
Okay.
For example, I just went for my annual checkup, and I had blood drawn, a couple of weeks beforehand, and all the doctor did was go over the results. I barely put hands on me as far as like touching and asking questions and so forth. And I've seen through the years, because I've been pretty healthy, knock wood, so I've kept an HMO, but it's more like we'll do the, what you're supposed to have, but they don't really push for anything else. I mean, unless you say, hey,
this or that.
Yeah.
So unless there's something that triggers a need.
Well, so I guess that's another reason.
It's very.
And that's more of a healthcare, insurance issue, in my opinion.
Yeah.
But it's like, okay, it says this, so we'll get this done. So unless any red flags come up, whereas I've talked to a lot of people with PPOs, and they seem to be much more and they get in quicker too.
Okay.
To see a doctor.
That's an interesting take on that.
And this is a very another off-topic kind of thing, but I usually interview my doctors. So I tell them I'm going to come in for an appointment, and I'll pay for the appointment if I have to, but I want to know, like, and those are questions you ask, like, how, if I have an emergency situation, how easy is it for me to get in? How long do your appointments typically last?
How long do you have to wait?
Right.
I mean,
are you more
overbook?
Right. Are you more of a preventative? Do you take a preventative look at things, or do you just deal with things once they become, acute and you have to deal with them? So yeah, I've always had a consult with the doctor, and it's hard to do that because it is an extra expense. It does take time, and nowadays a lot of people, you don't have the time, you don't have the money. You're picking a name out of a list and hoping for the best.
Right.
Exactly.
Well, we use Yelp.
Well, there's Yelp, and there are a lot of new apps and programs, and so you can at least
rate the doctors,
and also read what their philosophy is,
right?
Because that can play an important role.
And I think that's a good idea to do before you pick a new doctor.
Again, and this is just my own opinion from what I've seen. It appears that there's a lot of a laissez-faire type of attitude, unless you have a red flag or a major concern.
Well, and
you look at the numbers and say,
numbers look good, healthy body, moving right along.
Exactly.
This is an assembly line.
But maybe you should go in saying, here's what I understand is recommended for my age.
Right.
Are we going to run or if you want to have those tests run, it's time for me to have a colonoscopy and remind them.
Set one up. I set up another colonoscopy because of my age. But it was again, it's the data says this, so let's do that.
Right.
But it just seemed through the years more impersonal. It's like you said, Lita, assembly line. Numbers look good, you feel good, move on.
Well, I think the insurance companies can dictate how much time the doctors can actually spend with you, which is challenging.
Terrible.
Yeah.
Terrible for the doctors, because the doctors are human.
Sure.
And the doctors.
And you're human. It takes you a couple of minutes to just relax, I think, when you get to a doctor's office.
Right.
Yeah.
Right. And it's interesting we just mentioned that about routine exams. Why don't we talk about those?
Okay.
So, a typical medical exam for men may include a testicular exam, prostate cancer screening, and a hernia screening.
Okay.
And honestly, I just saw the doctor.
Yeah.
And
none of the above?
Nope.
Oh, huh.
So.
Okay.
Yeah. So, from what we're talking about, if you may want to talk to your healthcare provider, because if they have a testicular self-examination model for you to see and feel, these models replicate the feel of real testicles and often include lumps, so that you can get a better understanding of what lumps might feel like. And your healthcare provider can then demonstrate how to do regular self-checks at home. And I'm assuming that's similar to ladies with a breast exam.
Yes.
And actually, we're going to get into that.
We are. But and I did want to order a pair of or a testicular self-exam kit, model kit. But I was that was vetoed.
Once I got into models, she wanted to.
Well, I also thought we'll get back to it. And we'll talk about it again in a second. But if you've never done that, if the doctor's never shown you what a lump feels like, how would you know?
Right.
And how do you know if you're doing? I don't know if men are just taught how to do a self-exam. I think that's something you should learn how to do, and the doctor should show you, and you want to be able to say, "Oh, that's what it feels like."
Right.
Okay, I'm going to honestly say I've never had a doctor tell me, Dominic.
Nope, not
Nope.
Yeah,
Okay.
and
There
it's
you go.
interesting.
Yep.
See?
So here's another thing,
Yeah.
and I've actually heard this before, and some of our listeners may have, but men can also get breast cancer, not just women. Men can also get breast cancer, and they should also check their chest for any lumps or bumps. You should let your healthcare provider know if you notice any pain or discoloration, shape change, or anything out of the ordinary during your regular exams.
Good advice, Ron.
Yeah.
But wait,
Okay.
there's more.
Oh, what do we get with our?
Annual exam?
Yeah.
You're going to find out.
Okay.
For those of us born with a prostate, regular prostate checks are an essential part of our routine medical exams. Again, I'm going to say, I've got issues with mine.
Yeah. Didn't check it.
No, I was in for an exam, and doctor said, "Oh, well, while you're here," and they found something. And fortunate for me, everything is under control. But never really told, just because of your age, you go in so often and have the doctor check it up, and no self-checks or anything like that.
I don't know if that's something you could self-check.
Not really.
No, but they can show you again. They can show you a model, so you can
so that you know what
so
they're
you what
feeling.
so you know what it feels like
And
to
so
them.
and
what it
to
looks
make
like.
it more like a medical procedure instead of like
An invasive thing. I think that's what they should start with. Show you the model before they, because I think that can put people a little bit more at ease and say, oh, that's what they're doing.
Right, because it is kind of startling.
Invasive, yes.
It is.
Just like with females, it's startling for females when they have things done.
Right. But again, it's not knowing. At least if you have something showing you, or then you're a little bit better off. Otherwise, you just don't know.
Yeah.
And they should also be doing a check as part of that blood test to also help. And I guess, Ron, I'm going to be quiet because you're going to.
All right.
Well, even those people born with male sex characteristics who later had feminization surgery will need to have their prostates checked, as the prostate is not removed. I didn't know that. The prostate is not removed as part of the feminization process. Prostate cancer screenings may include a physical exam of the prostate and a prostate-specific antigen blood test.
Well, that's good to know, Ron. And how often should men get routine health checkups?
Well, according to the Mayo Clinic, healthy adult males less than 50 years of age should have a medical checkup every 3 to 5 years. And for those of us 50 and older, should have an annual health exam.
Okay.
That's great. It's not great, but that is good to know.
Yes.
For those born with feminine sexual characteristics, a routine periodic medical exam may include a pelvic exam, cervical cancer screening, a human papillomavirus or HPV test, and breast cancer screening.
Excuse me, one second.
Yeah.
Why don't men get the HPV test?
Yeah, that's a very good question.
Okay, that's my question.
And this is for anyone born with feminine sexual characteristics.
Right.
So it doesn't matter what your belief system is. It doesn't matter what your sexual orientation is. It doesn't matter. None of those things matter.
Right.
You still need to have the tests.
Right. Check it out.
Yeah, it's and for some reason, even healthcare providers have been ignorant of the fact that anyone with feminine sexual characteristics need to have those exams done.
Okay. Well, your healthcare provider is looking and feeling for any masses, lumps, bumps, growths, discolorations that may indicate further testing is needed.
Right, because like humans, we're pretty much symmetrical. So if something looks different, that you want to be aware of that. If something hurts, you want to be aware of that. If something's lumpy, you want to be aware of that. And the cervical cancer screening, often pap smear, requires a sample of tissue from the cervix, and so they use a speculum to get to access that area. And it's typically sent off to the lab for analysis. And sometimes testing will also be done for HPV at that time. So they'll take a sample of cells at that time for HPV as well. And sometimes when those test results come back, they might be inconclusive or questionable. So you may have to go back more than, you might have to get more than one exam done a year, depending on those results.
So how often should women have the mammogram? Is that based on age as well?
Yes. And it's, again, same with men and women. If you're younger, it's every 3 to 5 years. If you're older, it's every year. And I think men, it's over 50. Women, it's over 45. You want to start getting checked every year. And then as part of the breast cancer screening, it's a physical examination at the doctor's office. And then also a mammogram is done because some lumps are so small, you can't feel them, but they can be seen by a mammogram. So that's why that is an important part of breast cancer screening. They might also do biological blood type tests as part of breast cancer screening. And if you have a family history, you might have to start going annually at an earlier age.
Gotcha. Okay, we talked about male characteristics, female characteristics. Let's talk about gender neutral things for everybody.
Okay.
To have checked out on an annual basis, depending on, again, what you just said, your age, family history, and your overall health.
Right.
Okay.
That includes bone density scan, checking for osteoporosis, cholesterol for any lipid disorders, blood glucose to check for diabetes, blood pressure, check for hypertension, and colon cancer screenings, and that's just a few of them.
Right. That's right, Ron. And vaccinations can also be a part of your periodic wellness care for anyone, depending on your age, existing healthcare conditions, and other considerations. You and your healthcare provider can determine
Sure.
That's not a word. Which vaccinations you should receive and when you should get them. I know I had to get the shingles vaccine and the pneumonia vaccine once I hit my golden years.
And because of a previous injury that I had, I also had to get a pneumonia vaccine starting at a very young age.
Oh, okay.
And thank you for reminding me, I have to get my second shingles vaccine.
Oh, yeah, you better put that on your phone.
It was, but they didn't when I went in for the doctor's appointment, they didn't want to do both on the same day.
Oh, okay.
No,
yeah.
you can't do both on the same day.
Yeah.
For a routine checkup and a
Did you get any other vaccinations?
No.
Oh.
I got nothing.
Oh,
Again, I think
nothing.
it's more of an insurance.
They didn't order it.
Yeah.
Well, did you get your, did they talk about they probably talked about your cholesterol. Did you get in blood glucose and blood pressure?
I got all of that done, and I went in to see the doctor, and she's like, this all looks good, your cholesterol a little high, just, work on that a little bit, but, and then I said, well, what about the second shingles? Because I had it like 6 months ago, and she said, again, we're really not supposed to do this and this on the same day.
Wow.
So,
you have to sign
up for a new appointment.
Okay.
Yeah, and you don't even see the doctor. It's the nurse or somebody else.
Right. So,
But then you got to take time off of work to do it.
Or exactly. So it's again, that's why I'm saying I think it's more insurance related, but it's almost like hurting people.
It is, because it's taking time
Not
off of work.
Right.
Hurting, like
Hurting, yes.
But it's taking time off of work. It's taking transportation to get there and back. I mean, all right.
Yeah, and I guess it does come down to money, because if you have money, you can get an executive health physical, which is like 2 to 3 days, depending. And they'll do all the exams at that one shot. All the different doctors will meet together and discuss your case, and then you're good to go till the next year.
I've never heard of this.
Yeah, they have executive health physical.
You go and you stay in a nice suite and get all of your exams done quickly.
Oh, so that's when I use my American Express.
Yeah.
Or when PDX or PodcastDX is when we do our, what is it called when you do your initial stock offering?
Okay.
Oh, sure.
IPO or whatever.
Right.
Well, then when we do that, just
ISO,
make sure we have enough room for me to drive my Lamborghini in here.
Oh, sure, no problem.
And then I'll get that executive exam.
Okay.
Sure.
Okay.
So let's get back to
reality.
Yeah.
Vaccines.
The shingles vaccine, it starts at age 50, and if you've had what is that? Chicken pox?
Yeah.
Yeah. As a child, it's still part of your body. You are susceptible to getting shingles. And, you know, in my generation, most people got them as kids. So if you had it as a kid, you are susceptible. Does not mean you'll get shingles, but it means you're susceptible because it's in your body.
Right.
So at age 50, start getting the shingles vaccine.
And there's 2 of them.
Yes. And the pneumonia vaccine, age 65, unless you have any underlying conditions, you may talk to your healthcare provider. You may need to get them earlier than that.
Right.
Yep.
Like CPOD
or yeah.
Yep. And the bone density and colonoscopy, they're also part of routine checks when you're over 40. And the goal of all of these checks and vaccines is to help keep you healthier. Many diseases are easier to treat when caught early.
And I love the bone density. That's my favorite medical exam of all time.
Yeah, you just lay there.
It's so quick. It's so easy. It's
hurt.
quiet.
Yeah.
Yeah, I will happily go for bone density every day of the week.
Yeah. Isn't it a joy getting older, though?
Yeah.
And sometimes, like for me, I had a bone density before surgery. So.
Yeah. Well, you're right, Lita. Prevention is key. And early detection is important. I think we did a decent job at covering this, and it looks like that's what we have for this week.
Okay.
So, to all of our listeners, thank you so much for joining us today, and we hope you are staying as healthy as possible.
Yes, thank you for listening, and please don't forget to schedule that annual checkup.
Or a routine checkup if you're young.
Right.
Okay, if you have any questions or comments related to today's show, please drop us a line at PodcastDX@yahoo.com. Visit our website, PodcastDX.com. And please remember to like and follow us on Facebook, Twitter, Pinterest, TikTok, and Instagram.
And if you have a moment to spare, please go ahead and give us a review. It'll make a difference in your life and those around you. No, it probably won't, but it'll cheer us up.
It'll make us feel better.
Okay, good. As always, please keep in mind that this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. This is a podcast, and we are not healthcare providers. Your health and wellness are important, and we want you to know that we care about you. Always seek the advice of your physician or other qualified healthcare provider with any questions or concerns you may have regarding a medical condition or treatment and before undertaking a new healthcare regime. And never disregard professional medical advice or delay in seeking it because of something you've heard on this podcast.
Till next week.